CDC issuing a health alert to doctors across the country. The agency says not enough Americans are getting vaccinated against COVID, against flu, and RSV. And it warns that low vaccination rates amid rising respiratory illnesses, both here and abroad, could strain healthcare systems in the coming weeks. The CDC is telling doctors to encourage their patients to get the shots right now. The agency recommends everyone 6 months and older should get the flu and COVID vaccine. Research shows it is safe to get both shots at the same time.
So joining us now with an upcoming event to keep yourself healthy this flu season is Dr. Dan Vicencio, the Interim Chief Medical Officer at Near North Health, and State Senator Mattie Hunter. Good morning.
Good morning to both of you.
Thank you so much for being here.
Thank you.
Can you tell us a little bit, first of all, about this event that you have upcoming?
Well, next Thursday, the 21st, we're giving food away, turkeys away. We have a mobile unit that the doctor is going to speak to, and we're giving out vaccinations for COVID. And we're trying to keep the community healthy and happy and safe during this holiday season.
Most important.
Doctor, it seems that a lot of people who were immediately wanting the COVID vaccine about, 3 years ago now, my goodness, it's been a while, the vaccination rates have slowly tapered off. And then we have a rise in flu because of that. I mean, that first winter we had a drop in everything because everyone was social distancing and had masks on. Right. Why is it so important to keep up with this messaging of people to get their COVID vaccination, to get their flu vaccination?
People should realize that the COVID vaccination that we have this year is different than the initial COVID vaccination. It's a completely different strain that we're covering. We also have kind of felt a little bit like the past couple of years have been really constricting. So we've kind of started veering away from the things that we did back in the COVID days. So it's important to get back into the vaccination sphere and to get really used to getting your vaccinations.
What about RSV? I mean, this is a new vaccination, and some doctors are saying maybe hold off until we have more information. Others are saying why don't you get it, depending on who the patient is. Talk about that.
Well, if you're under 2, this is not a new vaccination. Every child under 2 should have been vaccinated for RSV because it was initially thought of as a childhood disease. But over time, the RSV has become a very big part of what's causing illness in our older populations and in our immunocompromised populations. So RSV now really pushing for people 60 and older, and also people who have immunocompromised conditions to get that RSV vaccinations because it can really cause problems with pneumonias later on down the road.
It was just mentioned there, it is safe to get these shots at the same time. And I think that kind of is a big fear for a lot of people, like to go in and get them both. Can you kind of speak to that and maybe alleviate those fears a little bit more?
Well, I'm someone who got it at the same time, but I have a little bit of inside knowledge. But the other thing to know is when you get a vaccination, you should really prepare yourself for vaccination. Drink plenty of fluids, make sure you're well hydrated, make sure that you don't have anything planned for the next day. So in case something does hit, you're not going to be busy trying to do something important. And also take, a pain reliever or something that's really appropriate for you right afterwards to cover the aches and pains.
Senator, when you're talking to your constituents about this, what do you say and what do they say back to you sometimes for the people who might be on the fence or maybe not at all wanting to get a vaccination?
Many people are actually on the fence. And so I had to say, well, hey guys, I had to get it. We work with thousands of people in Springfield. We come back home and we don't want to spread whatever if we got anything. So you wear a mask, you get vaccinated, and you take care of yourself and your family. You must protect yourself.
Absolutely.
Right. Senator, Doctor, thank you so much. Do appreciate your insight.
And that event again is happening on December 21st. And for more information on that, the food giveaway and the flu and COVID vaccine event, it is again next Thursday. You can check out your screen right now. All that information is right there for you. Again, guys, thank you so much for joining us.
Thank you.
Thanks for having us.
Our pleasure.
Top stories are coming up next.